Welcome to this masterclass review of Tymlos and Forteo, the power duo for osteoporosis treatment. Before we dive deep, a quick but important note. This video is for education and inspiration only. It's not medical advice. Always consult a healthcare professional and double-check any medical information with trusted sources. All right, let's get started. If you're serious about mastering osteoporosis treatment, this is going to be worth it. Osteoporosis isn't just about bone density, it's a fragility problem. Bones lose strength, and even minor falls can cause catastrophic fractures. That's where anabolic agents like Forteo and Tymlos come in. Unlike traditional osteoporosis meds like bisphosphonates, which mainly slow bone breakdown, these two actually build new bone. They're game changers, but they have to be used thoughtfully. Let's talk about their mechanisms of action. First, Forteo or Teriparatide. It's a recombinant version of the active part of human parathyroid hormone, PTH134. When administered once daily, that timing is critical. It stimulates osteoblasts to build new bone. Importantly, it does this without causing excessive bone resorption, which happens when PTH levels stay chronically elevated. Now, Tymlos or abaloparatide. It's a synthetic analog of PTH-related protein, PTHrP134. It also activates the PTH1 receptor, but binds and unbinds more rapidly than Forteo. This faster signaling produces a stronger early anabolic effect and a lower risk of hypercalcemia. Bottom line, both stimulate bone growth, but Tymlos may trigger that response a little faster. Now, how good are they in real life? Here's what the major clinical trials showed. 4. Vertebral fracture reduction of about 65%. Non-vertebral fracture reduction of about 53%. Lumbar spine bone mineral density gain of 9 to 13%. Hip BMD gain of 2 to 4%. Vertebral fracture reduction around 86%. Non-vertebral fracture reduction about 43%. Lumbar spine BMD gain around 11%. Hip BMD gain about 4%. Both are excellent for building bone and preventing fractures. But Tymlos appears to boost lumbar spine density a little faster and stronger. Now, who should not receive these medications? Contraindications include Paget's disease of bone, history of primary or secondary bone cancers, prior skeletal radiation exposure, young patients with open epiphyses, meaning children or young adults who are still growing, genetic risks for osteosarcoma, unexplained high alkaline phosphatase levels from a skeletal source. Why? Because in animal studies, particularly in rats, there was a rare but real signal for osteosarcoma, though it hasn't been confirmed in humans. Still, we stay cautious. So then who should get them? Let's walk through it step by step. If a patient has a T-score of -2.5 or lower, plus a fragility fracture, anabolic therapy is absolutely appropriate. If the T-score is between -3.0 and -3.5, even without a fracture, anabolic therapy is still very reasonable. If multiple sites have very low T-scores between -2.5 and -3.5, anabolic therapy should be strongly considered, especially if there's steroid use, rheumatoid arthritis, frailty, or frequent falls. You can also combine FRAX risk with the T-score. If FRAX predicts a greater than 3% risk for hip fracture, or a greater than 20% risk for major osteoporotic fractures, even if the T-score is only between -2.0 and -2.5, anabolic therapy might still be warranted. Here's a quick action plan. If T-score is above -2.5, generally no Forteo or Tymlos unless there are major risk factors. T-score between -2.5 to -3.0 with fracture, strongly consider anabolic therapy. T-score less than or equal to -3.0 without fracture. Anabolic therapy is very reasonable. T-score less than or equal to -3.5, treat aggressively. Strong case for Forteo or Tymlos. Any T-score plus multiple fractures, start anabolic therapy. Chronic steroid users prefer anabolic agents over bisphosphonates. What about FDA approvals versus expert-supported uses? Here's the difference. FDA-Approved Indications. Postmenopausal women to increase bone mass and reduce fracture risk. Men with primary or hypogonadal osteoporosis, Forteo only. Glucocorticoid-induced osteoporosis, again, Forteo only. Expert guidelines supported, though sometimes off-label. Severe osteoporosis with T-score less than or equal to -3.5, even without fractures. Multiple fragility fractures indicating severe skeletal fragility. Very high frax risk, hip greater than 3%, or major osteoporotic fractures greater than 20%. Failure of other osteoporosis medications, meaning fractures despite bisphosphonates or denosumab. Intolerance to anti-resorptives like GI intolerance or high jaw osteonecrosis risk. Cancer treatment-related osteoporosis such as ADT for prostate cancer or aromatase inhibitors in breast cancer. Severe adult osteogenesis imperfecta experimental use. Delayed fracture healing, another area of growing orthopedic interest. How are they actually used? Forteo is dosed at 20 micrograms per day subcutaneously. Tymlos is dosed at 80 micrograms per day subcutaneously. There's a strict lifetime limit. 24 months total of anabolic therapy, whether you use Forteo, Tymlos, or both sequentially. And what happens after finishing 18 to 24 months? You must transition the patient to an anti-resorptive agent like a bisphosphonate. This step locks in the bone density gains and prevents rapid bone loss. What side effects should you watch for? Common ones include nausea, dizziness, palpitations, and orthostatic hypotension immediately after injection. Leg cramps can occur too. Tymlos is more associated with local injection site reactions. Forteo carries a slightly higher risk of hypercalcemia. You should monitor serum calcium, especially early in treatment. Here's the final word. Tymlos and Forteo are powerhouse medications when used for the right patients. They aren't casual osteoporosis drugs. They're for high-risk patients where blocking bone loss isn't enough. We need to actually build new bone. Choosing between them comes down to the details. If you need faster lumbar spine gains, Tymlos may be the better pick. If you need broader approvals, including for men or steroid-induced osteoporosis, Forteo fits the bill. Use them wisely, transition therapy correctly, and you'll give your patients a real shot at avoiding devastating fractures and regaining quality of life. Thanks for tuning in. See you next time.